Situated on the shores of Lake Superior, Thunder Bay is a hub for the entire northwest region of Ontario. And as the only tertiary healthcare provider in the region, Thunder Bay Regional Health Sciences Centre provides comprehensive care to more than 250,000 people in a region the size of France. The community we serve is dynamic and diverse, and it is our commitment to our community that has guided the development of our strategic plan. As an academic health sciences center, we teach the next generation of healthcare providers and advance medical research through our research arm, the Thunder Bay Regional Health Research Institute. Patients benefit from interprofessional teams of dedicated healthcare providers and access to leading-edge medical technology and clinical trials. We are completely committed to patient and family-centered care, and it is on this cornerstone that we develop the 4 strategic directions that will guide us over the next 4 years. Equity, diversity, and inclusion, patient experience, staff experience, research, innovation, and learning. These directions, along with supports, will lead us to a stronger, healthier, and sustainable future.
Strategic Plan 2026 is very different because we have a new vision this time. Healthcare is different, and we've learned so much during the pandemic. This time, it's really about creating a better experience for our patients and their families. It's really grounded in our new vision being exceptional care for every patient, every time.
Equity, diversity, inclusion is kind of objective in healthcare, but it's actually an old philosophy in Indigenous worldview. I see this as a really important priority for Thunder Bay Regional to be pursuing. If it's addressed with Indigenous people, the work that and achievements that can be made, it will really create a welcoming environment for everybody.
Because of medical terminology and Western ways, we're not all educated in that way. We come from a remote area. We're not from the city. Everything here is different. It's strange. We're not able to trust right away. In order for that patient to get the best possible care, you kind of have to work with everybody involved. And not just this hospital, but that means with Indigenous care navigators as well.
When research is embedded in the organization, it will ensure that any changes we make to patient care are for the benefit of the patients, for improving efficiency, and will drive us to become a better organization. We can't deliver healthcare without compassion being embedded in everything we do. We must model it for our learners and for ourselves.
As patients, we recognize that good research always leads to improved patient outcomes. I can say unequivocally that the philosophy of the patient being at the center of everything we do is interwoven and integrated into every pillar of our plan. I love the tagline that says, "We all belong." That, to me, demonstrates that every patient is important.
In medicine, you're presented with clinical problems. And the clinical problems often have a straightforward textbook solution. You really have to be careful, and you really have to stop and listen to the person and listen to their family, listen to the other providers who may be seeing things through an entirely different lens than you and put it together. It's easier to treat diseases than people. And being able to step back and actually treat the person is an art in and of itself that takes more than just knowledge.
Lately, the staff experience has been physically and mentally demanding, with the recruitment of more nursing staff, allowing us to spend that much more time with the patients and have it less mentally and physically demanding on the nursing staff.
Education opportunities are out there for everyone. I'm excited to see that it's part of the new strategic plan as a priority, and I would encourage anyone to get involved in any kind of training that's offered to them.
We have listened to staff, included them in healthcare design, so that we can make changes to improve the work environment. If we improve the staff experience, the care they provide will also improve. These actions will benefit both staff and patients. Continued improvement on the staff experience at Thunder Bay Regional Health Sciences Centre is paramount, and we want this to be a place to thrive as a staff member and be treated with the quality care and compassion as a patient.
Really, when I think about a sustainable future, I think about the fact that we don't have to just focus on Thunder Bay, we have to focus on all of those populations across quite a vast geographical distribution. And that is going to require balancing the economical, social, and cultural environments that are all in place to help improve our health and health outcomes. Over the past couple of years, it's fair to say that all of us as healthcare workers are feeling quite burnt out, quite exhausted, as I'm sure all of the patients and everybody who's been affected from the pandemic have been. But we are quite optimistic about the future, and the strategic plan is making us quite optimistic about the changes that we hope to see for our health and our healthcare. And I think despite all of the challenges that we have had, we are all quite motivated to make improvements.